Kwekwe, Tanse Unusakut. Good afternoon. Bonjour. I'd like to acknowledge first that I'm here in Ottawa on the traditional territory of the Algonquin and Anishinaabe people, joined here today by Chief Medical Officer of Indigenous Services Canada, Tom Wong, Associate Deputy Minister Valerie Gideon. J'aimerais d'abord commencer en adressant l'enquête publique du coroner sur la mort de Joyce Echaquan, qui a débuté jeudi passé. Ceci nous rappelle encore une fois que beaucoup de travail reste afin de lutter contre et tenter d'éliminer le racisme systémique dans le système de santé au Canada. J'encourage tous ceux qui partagent leurs témoignages à être transparents et honnêtes à propos de leurs expériences. Prendre part à ces conversations difficiles, être à l'écoute et apprendre de celles-ci est primordial pour la réconciliation. La guérison est la base de la réconciliation et cela exige que les Autochtones et les non-Autochtones travaillent ensemble en partenariat. Nous savons tous que la vérité vient avant la réconciliation. Tragiquement, cette semaine, la vérité se trouve entre les mains d'un coroner. We all know that truth comes before reconciliation, and sadly, this week, the truth is in the hands of a coroner. Les peuples autochtones ont le droit de recevoir des soins de santé de premier ordre, sans crainte de discrimination ou mauvais traitement. Personne ne devrait souffrir les indignités que Joyce Echaquan a subies et aucune famille ne devrait avoir à subir ce que sa famille a dû affronter. Je continue de saluer le courage de Carole Dubé et de sa jeune famille pendant cette période fort difficile. Our government has held 2 meetings to address anti-Indigenous racism in Canada's healthcare system and hear about the lived experiences, continued daily experience of Indigenous patients and practitioners. During these national dialogues, the Government of Canada reaffirmed our commitment to address anti-Indigenous racism in the healthcare systems through various measures, including the co-development of distinctions-based health legislation to deliver high-quality, first-class healthcare for First Nations, Inuit, and Métis. This work is supported by $15.6 million over 2 years for engagement, which started in 2020, as announced in the fall economic statement, as well as $107.1 million for 3 years beginning in 2021-2022, announced in this recent budget 2021. And this, as well, in addition to $127 million over 3 years to prevent racism, systemic racism, in the healthcare system. Moving to the topic of COVID cases and vaccinations. As of May 18th, yesterday, we are aware of 687 Indigenous communities with vaccinations underway. A total of 452,043 doses have been administered, of which 149,014 are second doses. This now represents 74% of adults with at least 1 dose, and critically, 36.1% with both. There's no letting go, but this is great news. And I salute the members, in particular of the Canadian Armed Forces, who've done such an admirable job in rising to some of these challenges. They are deployed to help communities in need and are also working on the rollout of the vaccine. Despite the progress that we're making, challenges do remain. In Nunavut, for example, public health officials are still dealing with an outbreak of cases that began in mid-April. Nunavut has reported that the number of active cases has now fallen to 64. Officials are working hard to contain the outbreak, including by reminding everyone to follow public health guidelines to limit the public gatherings. We continue to monitor the outbreak in the Skandiga First Nation very closely and are actively working with the community as well as the province of Ontario, Matawa Tribal Council, and the Sioux Lookout First Nations Health Authority to ensure they have the supports they need to take immediate measures to reduce the chances of further spread. Indigenous Services Canada has also provided specifically an additional $96,000 in COVID-19 relief funding through the Indigenous Community Support Fund to support food security, baby supplies for families in isolations, and traditional harvesting and surge capacity support. We've been encouraged to see efforts across the country to administer vaccines to Indigenous communities in a manner that respects traditional cultures. For example, at Windsor Regional Hospital, there's space dedicated for Indigenous peoples, which honors traditional art and the 4 sacred medicines cedar sage, sweetgrass, and tobacco, which are available for patients. Additionally, staff, including Sarah Williams, a nurse who is a member of the Umjinung First Nations, performs weekly smudging ceremonies. Feedback from the community has been extremely positive. Another positive note is that Indigenous leaders continue to encourage their communities to get vaccinated. In Manitoba, for example, the Southern Chiefs Organization, Manitoba Kwetnu Assembly First Nations Chief, Kwetnu Inuit Minoan First Nations Health Social Secretary in Manitoba, and the provincial government are all working together. Recently, they've launched the Protect Our People MB campaign. This high-profile campaign to reach youth includes social media star Sherry McKay of Saskatchewan First Nation and singer William Prince from Peguis First Nation and other media personalities. The campaign will reach their audience through social media and will include medical information to debunk misinformation about vaccines. This campaign is of crucial importance to protect communities, as Manitoba now has the highest rates of new infection in the last 7 days in Canada. Also in Manitoba, we're seeing strong uptake for Indigenous peoples getting their vaccination. The vaccination rate for First Nations people living on reserve as of yesterday, May 18th, is now over 80%. And in Ontario, I'm happy to learn that Indigenous peoples living in urban areas are now eligible to get their second dose of vaccine 3 to 4 weeks after their first dose, rather than 16 weeks. And this is good progress, as it recognizes that Indigenous peoples face vulnerabilities, whether or not they live on or off reserve. The Métis Nation of Alberta opened a new temporary clinic in Lac La Biche this past weekend. This is one of 3 temporary clinics the nation is running in May. The other 2 are in Fort McMurray and Calgary. The Métis Nation of Alberta has been a strong leader in the effort to deploy vaccines. They opened the first Métis-led clinic back in March. Also displaying great leadership in Alberta, the Siksika Nation has announced that they will be expanding their rollout of vaccines to include their neighbors in rural areas. And Chief Crowfoot, amongst others, have announced that they will be offering vaccinations to the communities of Vulcan, Newell, and Wheatland County in the coming weeks. Continuing in the West, in Saskatchewan, Indigenous leaders are reporting that uptake of vaccines has been high. For example, Chief Iron of Canoe Lake Cree Nation estimates that 60 to 70% of his communities have received their first dose. And for the province overall, 60% of adults on reserve have received their first dose. Clinics have also crucially been operating in urban areas. In the north, the vaccine rollout in Yukon is making great progress as well. As of last week, the rate of vaccination for adults is 80% for the first dose and 70% for the second dose. And officials recently announced that in the coming weeks, they'd start vaccinating the youth from 12 to 17. And they expect that youth in the territory will be fully vaccinated by mid-July. And in the Northwest Territories, 82% of the population has one dose, with 60% of the population being fully vaccinated. And as for the number of cases, as of May 13th in First Nations communities on reserve, we're aware of 861 active cases, which brings us to a total of 28,319 confirmed cases positive for COVID-19, and there are therefore 27,130 recovered cases with, tragically, 328 deaths. Comme je l'ai mentionné, le nombre de vaccinations augmente rapidement. Cependant, nous devons demeurer tous vigilants et bien suivre les recommandations des autorités de santé publique. Même avec l'arrivée du beau temps et l'envie de sortir dehors, c'est toujours important qu'on limite le nombre de contacts que nous avons avec des personnes à l'extérieur de notre entourage immédiat. C'est important de porter un masque dans les lieux publics. Nous sommes conscients des assouplissements aux États-Unis concernant le masque, mais pour le moment, l'Agence de la santé publique du Canada recommande que l'on continue de porter un masque jusqu'à temps que le taux de vaccination soit plus élevé, que le tableau épidémiologique s'améliore et que les hôpitaux, les unités de soins intensifs et les services de santé publique ne soient plus débordés. Et s'il vous plaît, évitez les grands rassemblements, continuez à pratiquer la distanciation physique et lavez-vous les mains régulièrement. I want to give thanks once again to Indigenous leaders across the country who have worked so hard, will continue to work hard to coordinate the rollout of vaccines with public health officials and to keep communities informed during these challenging times. I also want to recognize health practitioners again who have displayed so much dedication and devotion to keeping people safe. We're almost through these dark times. Keep on taking care of one another and stay safe. Miigwech, nakumik, merci, thank you, et merci.
Je reconnais que je me trouve sur le territoire non cédé du peuple algonquin. We are seeing outbreaks are still occurring in some communities. Why? We are seeing outbreaks because that's a result of ongoing gatherings, large and small, and not following public health measures. We are also seeing some shifting of new cases to younger populations. As immunization is ramping up in many Indigenous communities and other public health measures are being followed, we see less and less cases in many communities. And this is attributed to the tremendous efforts of Indigenous leaders. To continue this momentum, it is important to follow the public health measures and redouble our efforts for vaccination. Vaccines prevent serious outcomes, hospitalizations, ICU admissions, and saves lives. To continue our work, it is important that we share some examples of the incredible efforts that are currently taking place across the country. Most regions are planning and beginning vaccination efforts in Indigenous youth, including the territories Manitoba, Ontario, and Labrador, now that the eligibility of the Pfizer vaccine has been lowered to as young as 12 years of age. As well, there have been many successful urban Indigenous vaccination efforts, including a vaccination clinic in Winnipeg that began last month and has already administered 3,000 doses. The clinic has a goal of fully vaccinating 23,000 Indigenous community members by the end of September. One of the individuals at the clinic expressed how good he felt after getting the vaccine, feeling that it was a reward for his patients. We are excited to see thousands of doses of vaccines coming to Indigenous communities, and with adherence to public health measures, we can long for a summer with more freedom. Miigwech nakumik marsi.
We'll now take questions from journalists. One question, one follow-up. Nous allons maintenant prendre les questions des journalistes. Une question et une question de suivi. Operator, first question, please.
Thank you, merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Christy Kirkup, the Globe and Mail. Please go ahead.
Hi, good afternoon, Minister. I'm wondering if I can ask you, some First Nations leaders have raised concerns recently about the timing of the upcoming election of the AFN National Chief in July, citing connectivity challenges. I'm wondering if you have any thoughts or concerns on the current timeline of the AFN National Chief election.
Thanks, Christy, for the question. I just want to salute every Indigenous leader coming forward to put their names up for election. But I am a minister of the Crown. I don't think, and it is not right for me to have any view at all on that.
You have a follow-up, Christy?
Thanks, Minister. Yes, thank you. And just on another topic as well, Minister, just on Bill C-96, I'm wondering if you've heard anything from your constituents about whether they're comfortable with the Quebec government pursuing Bill C-96, or if not, how will you address their view?
Well, they do. Anyone in Quebec, or I think most Canadians, know that protecting the French language is key to our country as a one that is officially bilingual. To think that someone like me that has 6 or more generations of his family from Quebec doesn't have a view on protecting the French language is got another think coming. Frankly, I do have a view. I spent most of my education, all my education, in French, save for law school at McGill, including a master's at University of Montreal in political science, with my good friend Stéphane Zion as a teacher. I have raised my children in French. They speak 3 languages at home. So I have a very deep and profound view about preserving French in Quebec. And I will not hesitate to share that. I also have a deep value for protecting the English language in Quebec. I have a profound duty as a minister to protect the French language outside Quebec. And that is the reason I'm part of the party that is sitting as part of government here today, and we won't hesitate to defend that. Our job as federal representatives is to protect French, to protect language minorities, including English in Quebec, as part of our jurisdiction. And the Quebec government and any other provincial government's job is to protect what they see fit to protect in the case of Quebec in their jurisdiction. So to make, I know this is a long answer, short, we need to do our job in our jurisdiction federally to ensure that French is protected in Canada, English language rights protected, notably in Quebec. And Quebec, obviously, and it has said so quite publicly, needs to do its job in its jurisdiction to protect languages, including foremost French in its jurisdiction.
Thank you, Christy. Next question, please.
Thank you, merci. The next question is from Karen Pauls from CBC National News, Manitoba. Please go ahead. Ms. Paul?
Hello, can you hear me?
Yeah, we can hear
Hello?
you. We can hear you.
Okay, sorry. I'm calling about the state of emergency called in Shamattawa First Nation yesterday about concern over suicides. They've asked for mental health services for children and adolescents from the federal government, and the chief is saying all he's getting back from the department right now is fluff. He wants to see boots on the ground, and he wants to see them immediately. Minister, can you tell us if you're sending anyone up to Shamattawa, what the status is, and what kind of help you can offer them?
Yeah, and thanks. I did reach out to Chief Redhead yesterday to offer all our supports. And when we had an exchange by Facebook Messenger, if you need to know, but that was followed up prior to that, followed up after and prior to that by our First Nations Health Authority regional director, and we will do everything for them to help them. The events in Shamattawa were absolutely tragic, and indeed, what they went through during the second wave was also a great crisis. So we're moving quickly to give them whatever they need to support the community in their time of need. I know Valerie has been working more intensely on it, so I'll pass the mic over to her for a more complete answer.
Absolutely, Minister. So our departmental regional executive has had a conversation with Chief Redhead. They have confirmed that they have short-term crisis counselors made available through MKO and the Keewatin Tribal Council. We've also been able to identify a Jordan's Principle funded children's mental health therapist, as well as an uninsured health benefits mental therapist that are available. And we will work with Chief Redhead to identify additional specialist expertise relating to children and youth mental health. We have contacts in the provincial system as well that can assist us to mobilize quickly. But I think really working with the community on a medium and longer term strategy that can be funded through Jordan's Principle to help support those children and youth that are at risk of suicide, as we have done with other First Nations, for example, throughout Anishinaabe-Aski Nation territory on the Choose Life initiative.
Okay, just to follow up, as of 20 minutes ago, there are no crisis mobile teams on the ground yet, either from MKO or Keewatin. How quickly can they expect to see those two people funded by Jordan's Principle on the ground?
Sorry, do you want me to?
We'll get them whatever they need as quickly as possible. We got confirmation yesterday that they did have resources in place to deal with the immediate. I think there are a number of equally urgent steps that need to be taken quite shortly after it, as well as a long-term portion that we will be working with the community to address. There's a greater mental health challenge in the community that we need to address as well, but there are also the crisis supports, particularly given the very, very young age of the individual in question and the impact that can have on the community. So we're not waiting for things to happen.
Thanks, Karen. We'll take one more question over the phone and then turn to the questions in the room. Nous allons prendre une autre question par téléphone, ensuite des questions dans la salle. Operator, next question, please.
Thank you. Merci. The next question is from Camille Cassisi-Monette from Radio-Canada Manitoba. Please go ahead. La parole est à vous.
Bonjour, M. Miller. J'étais avec ma collègue Karen. Donc, la question est la même. Je voudrais simplement obtenir une réponse en français. Donc, on sait qu'il y a eu un épuisement dans la population qui semble généralisé dans Première Nation, dont celle de Chawatama. On voulait savoir qu'est-ce que vous comptez faire, quelle action vous comptez prendre concernant la récente tentative de suicide d'un enfant de 7 ans.
Mais hier, quand j'ai appris de la tragédie dans la communauté de Chamadoua, j'ai fait le suivi immédiatement avec mon département pour savoir l'état des choses. Évidemment, l'âge de la personne en question amplifie le drame immensément. J'ai communiqué avec le chef Redhead par la suite pour m'assurer directement qu'il avait les appuis dont il avait besoin. J'ai eu l'assurance que dans l'immédiat, c'était le cas, mais on a à faire tout ce qu'on pouvait de la part de Services autochtones Canada en lien aussi avec KTC et MKO dans la région qui ont des appuis tissés un peu plus sur mesure pour appuyer la communauté. Mais ma réponse au chef Redhead, c'est on va être là pour vous, on va déployer tous les efforts qui sont nécessaires, que ce soit les supports et les appuis en lien avec Jordan's Principle ou autres liens qui puissent aider la communauté avec ce drame qu'il traverse présentement.
Parfait. Et en termes de délai, en fait, c'est quand la communauté de Chamatabwa peut s'attendre à recevoir, car le cri d'alerte est lancé en urgence?
Ben, le plus vite possible. Évidemment, il faut savoir précisément quel est le besoin. J'ai eu les assurances pour l'instant que dans l'immédiat, c'était réglé, mais il y avait aussi une demande pressante pour avoir des soins sur mesure, surtout donner l'âge de la personne en question et l'effet d'entraînement que ça pourrait avoir dans la communauté.
Juste rajouter que nous avons confirmé qu'il y a des professionnels en matière de la santé mentale qui sont présents dans la communauté, qui sont financés par le principe de Jordan et le programme des services non assurés autochtones en matière de la santé mentale. Donc, les appuis supplémentaires de MKW qui est ici sont mobilisés par la communauté directement avec leurs partenaires et vont arriver d'ici peu.
Merci, Camille. Prochaine question, next question. Kristen?
Tansei, Kristen Ashday with CTV National News. Yesterday, a nurse testified at the Joyce Etchiquan inquiry and said there is a perception among her colleagues that Indigenous people are alcoholics or drug addicts. Since Etchiquan's death, staff have been required to watch a 3-hour video about the community's history and culture, but the Indigenous leaders there feel like it's not enough. What is your thoughts on this, Minister? You talked about, meetings and sit-down meetings with Indigenous leaders and work is being done, but what exactly is being done to this hospital that is being questioned?
It isn't enough. I mean, quite frankly, and it isn't limited to that hospital in question. The coroner's public inquiry is trying to get to the truth, the very, very painful truth about prejudice, racism, and the impacts of systemic racism. We have a heck of a lot of work to do, and we put the financial supports in the budget to address it around the country, not only in addressing health transformation, but tackling head-on racism and systemic racism in the healthcare system. Those really difficult and painful truths need to come out. The fact that those perceptions exist with respect to Indigenous people is causing people to die. And that is documented. It's documented in the medical profession. It's a complete prejudice. It's complete trope. You just need to look at generalized levels of people that don't drink, and they're higher in Indigenous communities. People that look like me drink a whole hell of a lot more. Yet I don't get that perception when I go into the hospital. Someone that is Indigenous and that may be having an aneurysm, the suspicion might be that they're I mean, I have a doctor beside me that can tell you all about it, but I keep hearing these stories and they get confirmed by these coroner inquiries. And the conclusion to this is that once we get that truth out, we have to start addressing it by dealing with people's biases. They're obviously outward racism, but systemic implicit biases that are leading to negative health outcomes and killing people, not by the fault of any product of any medical practice, but by people's beliefs and views and how that impacts their diagnosis. Highly educated people. It takes a lot to become a nurse. It takes a lot to become a doctor. But that perception remains. So that's part of the puzzle. And it's the doctor that teaches in Manawan also teaches a course in university to address even unconscious bias. And the results are astounding. And if we don't, as a government, recognize that that exists, we can't start fixing it. And it's not about pointing fingers about who's doing right or wrong. It's about recognizing it and then changing how people behave and how, at a critical point when people are at their most vulnerable, they're suffering the effects of it. So that was the case, notably with Joyce Echaquan. The testimony of the nurse is just further evidence of that. Also, the testimony that people that it's a taboo subject. People feel like they'll be judged if they don't confront their biases, which is why there is a more of a publication ban, and there's a purpose for that as well. I know, Tom, I know you face this more in your daily practice than I have, but please feel free to comment.
We absolutely have to face this. We cannot sweep this under the carpet. Can you imagine the individual who is so vulnerable coming to actually seek help in a clinic, in a hospital, and what do they get? A worse outcome because of their race. It is not acceptable. We have to have zero tolerance for that. Thanks.
Yeah, no, I have family members and people that I know, friends and family, that choose not to go to the hospital because of this. It's a big issue. Minister Miller, I just want to touch your thoughts again. What is your message to doctors and nurses that are struggling and have these thoughts? What do you want to let them know as this is all unfolding right now?
And first, Chris, thanks for saying that. After the In Plain Sight report that came out from Mary Ellen Turpelafont, as well as the tragic events in and around the death of Joyce Echaquan, so many people like you and other reporters that are Indigenous came up to me and have told me about their own experiences and the experience of whether it's their mother or relatives. It is happening across Canada. It's underreported, despite the great report that came out of BC. And what I think was most painful, it's normalized. People say, well, that's what I get when I go in, and it prevents people. So forget the bias that you might face when you go in and take the decision to go in and get treated like crap. There are people that will refuse to go get treated because of that apprehension. So that has guided everything in terms of how we see perhaps even vaccine rollout currently, and how we have to be culturally responsive. It's not a theoretical discussion. There are proof points, and when you address it, you can fix it. So I'll paraphrase Minister Bennett, who is a doctor and very passionate about these issues, and is very much responsible for pushing this within government. You can't mend what you can't measure. So there's a lot of difficult discussions. There's a reform within the professional organizations that needs to happen. That falls squarely within provincial jurisdiction, but we all have the job to call out racism and systemic racism. There's work across the board to be done, and I think that's the difficult position we're in, because we have to play the role at the federal level as, yes, we have a very important responsibility over health in Canada. If anyone contests that, they should examine what's gone on the last 15 months. We have a very important responsibility on reserve, but we also have a role as a convener with respect to our provincial and territorial counterparts that have jurisdiction and expertise in the field, and bring them all on board. And again, Tom, you can add on this, because your doctor.
It is so important to get rid of any biases, any discriminatory practices. We cannot tolerate second-class citizens in this country. If we do that, how many lives are we going to be losing? Thanks.
Morning, Minister, or afternoon. Teresa Wright from the Canadian Press. Dr. Wong mentioned that there is a greater increase in cases among younger people. So I'm wondering if you can tell me what provisions have been made to get Pfizer doses to First Nations for youth, and what is the plan to get them vaccinated? Do they have the freezers, the special syringes that they need, and training for how to use them?
Yeah, and it's key, Teresa, because we're luckily as a country, and I think it's something that we can obviously in the third wave we can be cautiously quite proud of. When we're looking at Indigenous communities and the profile of the vaccination ahead of the curve compared to the rest of the Canadian population, and it's something that we have pushed from the very beginning, and it's yielded the results that it has yielded. Yet what we're seeing is now looking forward what those worrying trends are. So obviously the last 10% of the people we need to get vaccinated is a lot more difficult than the first 10%, regardless of the priorities and efforts we put into it. Those percentages tend to be younger, they tend to be more vulnerable, and a little more difficult to reach. Within the youth populations, we see a little less vigilance in getting that second dose, which is key. And that can play out in many areas, particularly in parts of the country where we have larger segments of the population that are youth. So it was obviously welcome news that Pfizer, the recommendation with respect to Pfizer went down to 12. So there's a whole logistical deployment in making sure that fridges, freezers, and the proper indications and strategies are getting out to that younger segment of the population, which is so key in chasing the elusive herd immunity or group community immunity that we're all looking forward to. So that means tailored approaches. Some of the things that have worked is there is a limit that you reach with respect to mass vaccination clinics. You have to be a little more innovative, whether that's door-to-door or youth strategies. We see that in the north, some of the spreads have happened in areas that are predictable, i.e. people that are unvaccinated. And that causes us to mobilize a tremendous amount of resources, obviously, when the healthcare systems there are a little more precarious. So there's a whole logistical operation going on that includes more operationability in and around the use of Pfizer. Valerie?
That planning is actively underway. It's quite exciting, actually, to see that in Manitoba, for example, by June the 18th, they're planning to complete their on-reserve first dose clinics for youth 12 to 17, about 18,000 youth, right? The Yukon has started NWT. I think Tom gave some of those examples in terms of his remarks. And we have a more youth-specific communications group that we've convened to really look at what are those best practices to increase uptake among youth. The Yukon, for example, is looking at providing Pfizer in schools before the end of the school year, right? So for those jurisdictions where kids, youth are actively in school now, right? That's an option. You have a pretty much captive audience there, and it sort of takes the logistical complexities away from families having to book appointments or travel into clinics. So we're going to continue to profile those success stories so that they inspire other jurisdictions. Tom, anything further?
Thank you, Valerie. In addition to that, one size doesn't fit all. So different communities in different parts of the country, the youth and the communities will work together to try to find the best approach to reach out to youth. Sometimes youth may think that they don't need a vaccine because they're strong, they're healthy. But this virus, as we are seeing, they can actually, both attack both the elders as well as the young. And we are seeing young people ending up, in emergency room or even ICU. So, yes, thanks.
Minister Miller, in December of 2019, I attended an Assembly of First Nations Special Assembly, and a young woman who was a youth representative went up to the mic and began crying and asking for help for young Indigenous people because of suicide crises. And just, you're taking questions today about, one First Nation in Manitoba, but this has been an ongoing issue. So why does it take a community calling it a crisis and begging for help for there to be enough just resources being given to these communities so that it doesn't get to a point of a crisis?
And to your point, that the first week that I became minister, there was another crisis in Saskatchewan, and in fact, it was the first community that I went to visit. It's clear that we are, as a country, not dealing with mental health and suicide in a way that is yielding the results that we all would like to see. We, as a country, of the FSIN at that point had a strategy that is a well thought out strategy. They continue to have great strategies that are put forward to make sure that things are community-based supports, culturally relevant, to help prevent suicide. I mean, right now we're in crisis mode, and so ideally you wouldn't want to be in this situation. So we all have to rally and make sure the community is supported. And when these things happen, it's easy to get, a big city can get overwhelmed if some tragedy of this nature were to happen. So a tightly knit community can need supports from the exterior that they don't have, and that's just the reality of it. You want to be in a position, obviously, that for the immediate aspect of the crisis, they can move quite quickly, and that's what we've done. But we want to look with them to address not only some of the shorter term needs for all the other youth in the community. This is particularly prevalent in communities that have high youth proportions. So that approach also has to fold in longer term solutions so we don't get to this situation. The Hope for Wellness line has documented a massive increase in mental health challenges in Indigenous communities over the course of the crisis. And I've said many times, and I continue to believe it, that we haven't fully measured the impact of COVID on a hidden mental health crisis, which includes problematic substance use, which includes iteration and suicide, but everything on the spectrum that falls a little short of those two things. The budget put a significant number into mental health. We recognize that it is a challenge. It is a challenge that we have to face as a federal government, Indigenous governments, as well as provincial governments as a team. And I think, there are strategies that work well. It can't be a federally imposed solution. There are great strategies that exist, whether it's FSIN, whether it's the Inuit strategy. AFN has a more of an umbrella strategy that they've proposed. But our efforts have been on the mental health spectrum as it touches suicide and iteration to support initiatives that are locally driven. Are there enough resources in communities to address mental health in a culturally relevant way? I don't think I can tell you that. I don't believe that to be the case. We know that that locally driven solutions do work, whether that's on the land options that have been so successful during COVID, keeping people physically distanced but also mentally well. There are a number of options I could talk to you about, but right now there's a community in mourning. There are other communities that have faced suicide. I think the particular age of the youth in question is especially heartbreaking in the circumstances. So there's no easy answer to that, Teresa.
I could keep asking questions, but
Was that number one or two?
Well,
It was two, but if you have another one, we have time.
I guess I understand that it's a very complex issue, but this is what I'm wondering. Just throwing money at it isn't working. The different strategies so far, this keeps happening. So I'm just wondering, what can be done, what is being considered, and what steps and like how far are you willing to go? Because frankly, if this was happening in a non-Indigenous community, I think that there would be a different response.
Yeah, and what we've realized quite quickly is you can't do good public policy by crisis. This is a particularly difficult moment for the community, and we'll be there for them. But I think the reflection in the shorter to the medium to long term is that they shouldn't have been in this situation in the first place. When, I don't like sitting here and talking about a specific community and the challenges that they face. When we went through the huge outbreak in COVID in Shamattawa that shut the community down, you realize quite quickly that this is one of many problems the community faces. It is why we needed to deploy the armed forces and have food security options, mental wellness supports, increased mental wellness supports. This is a community that has had challenges, but they're also strong, resilient, and proud. And accompanying them through this is a really holistic challenge. You can't have a situation where you send in 2 therapists and then you're out after a week, because that just betrays the severity of the challenge. You have to deal with housing, you have to deal with mental health, you have to deal with substance use, you have to deal with education and healthcare, and closing infrastructure gaps that have made this community quite vulnerable. It's not to say they aren't proud and strong people. They aren't. I've had many conversations with Chief Redhead. He's a young chief trying to make a difference in his community. But there are a heck of a lot of challenges, and they aren't the only one in Canada. I think it starts by us realizing as a government that these problems exist in a country such as ours. I think oftentimes we hide from it, but we've made a commitment as a government to support them. That'll take partnership with the provincial governments as well, and anything that deals with health transformation and wellness. So I'm not going to sit here today and tell you I have all the answers to it, because I really don't think we're doing enough. I think we put amounts and dedication and supports into it, but that has to go hand in hand with our relationship with Indigenous communities. That is one that has to be a lot closer than it's been up to now.
Thanks, Teresa. That concludes today's press conference. Ceci conclut la conférence de presse. Merci.
Thank you. Merci.